Hello, everyone. Good afternoon. Thank you so much for joining us today for another Mental Health America of Hawaii Brown Bag presentation. For today, we have for you Youth Mental Health in Hawaii. My name is Amanda Martinez. I am the Training Program Manager for Mental Health America of Hawaii. Thank you again for joining us for today. Just a little bit of housekeeping stuff before I dive in to the presentation. We are on webinar format, so you will not have the ability to turn on your cameras or unmute, so don't worry about accidentally turning anything on or anything like that. It should not happen. However, I do encourage interaction, so I like to keep the chat box open during the entire time, and I'll keep my eye on it as well. If you have any comments or want to answer any questions or ask questions, please feel free to drop that into the chat box. You also have a Q&A feature too, if you want to throw any questions in there. I anticipate leaving some time at the end for any questions that may pop up. You will also be getting a copy of these slides, and today is going to be recorded, so we'll get a copy of that recording as well. So don't worry too much about scrambling to take notes or taking pictures of the slideshow. Unless that's how you learn, then please, by all means, go ahead and do that, but you will have access to a copy of the slides after today. Right, so a little bit about who we are as an organization. We are a nonprofit organization established in 1942, so quite a while ago. We do consider ourselves a statewide organization. We have an office on Oahu and a smaller office on Maui as well. We try to partner with as many schools and organizations, agencies, and community partners as well, just to be able to extend our reach and be able to share resources as far and as widely as we can across the state. Our mission is to promote mental wellness through education, advocacy, service, and access to care. So historically, Mental Health America of Hawaii has been a part of or the lead of several different kind of task forces and coalitions that aim to promote access to mental health services, to raise awareness about mental health as well. Education is where I spend the most of my time, so doing presentations like these or going into schools with our youth suicide and bullying prevention presentation. Service, we don't quite provide direct services through our organization, so we don't offer counseling or therapy or anything directly like that. However, we do try to connect people to those services, right? We believe in access to care. So people are able to call our office or send us an email, contact us if they have kind of general questions about mental health, or where to start looking for different types of mental health services here in the state, and we are able to point them in the right direction to the best of our ability. So I want to start off with a little bit of icebreaker, since we are, I should say I, tell you a little bit about our organization for today. So I'll go ahead and launch it. It should pop up automatically on your screens, and your answers should be anonymous, so don't worry about your names popping up next to your choice. But what we have today is, when passing by a reflective surface, I use it to see if anyone is following me. I check myself out, because doesn't everyone? Or I use it to contemplate the deeper meaning of life. Give folks about a minute or so to participate if you are able to. If for some reason you do not see the poll on your screen and you want to participate, feel free to drop your responses in the chat box. You can make it either a message directly to me, or you can make it available for everyone to see. See the responses coming in. I usually like to wait until a majority of folks have had a chance to participate, which looks like we're pretty much there. So for time's sake, let's go ahead and take a look at our results. All right, so it looks like we got a little bit of a mix here, right? So 24% say they would use it to see if anyone is following them. The majority of you folks, 59%, said I would check myself out, because doesn't everyone? And 18% say they would use it to contemplate the deeper meaning of life. So thank you so much for participating in that little bit of an icebreaker. I think it's helpful to have a little fun in these Zoom meetings and doing a fun icebreaker, but there is a point with this as well. And the point really is certainly not to turn us into mental health clinicians, right? Or direct service providers. Unless you already are one, then thank you, we love you, and we need you in this world. But with this presentation or any of the other presentations and trainings that we offer through Mental Health America of Hawaii, is very prevention focused, right? We want to focus on providing information, tips, resources, that can increase our noticing skills a little bit more, right? So when we pass by the reflective surface, we notice it maybe in different ways, but noticing and practicing our listening skills are actually a really important part in supporting ourselves and supporting other people. Right, so if I were to choose an answer for this one, I would probably use it to see if anyone was following me, because I'm a big true crime fan. I watch a lot of movies and television shows, documentaries, and listen to podcasts about it. So I would definitely see if anyone is maybe a little too close for my comfort level. But again, there's no real right or wrong answer with this one. But thank you for those of you who were able to participate. Why don't we go ahead and start by taking a look at some of these statistics? Okay, so what does mental health look like specifically for our youth here in Hawaii? So we got a couple different sources that I'll be going through over the next few slides. Mental Health America as a national organization offers a State of Mental Health in America report every year. So we'll be taking a look at that report from 2023. We'll also be taking a look at the Youth Risk Behavior Survey, right? So information directly coming from our youth. They did just release the 2021 data, so we'll get a little bit of an update from those numbers. And Mental Health America as a national organization also offers free online screening tools, so we'll take a quick glimpse at some of those results as well. Right, so from the State of Mental Health in America report from MHA National, they found that about 18% of youth in Hawaii experienced at least one major depressive episode, about 6% experiences substance use disorder. Of that, about 18% that experienced a major depressive episode, they found almost 75% did not receive any treatment or any kind of help. And these numbers are a slight increase from the 2022 report. So for at least one major depressive episode, it's up about 4%. For substance use disorder, it's up about 2%. And then for those with a major depressive episode who did not receive treatment, that is up about 4% as well. So we're starting to see that slight increase, but I don't think that comes as a surprise to anyone who's on the Zoom webinar for today. We know that there is a youth mental health crisis. The Surgeon General released that report. So we are very well aware. We're doing our best to put as much into prevention efforts as we can, just to be able to help support our youth and empower our youth to support themselves as well. But I do think that this is reflective of the type of help-seeking behaviors that we have been seeing, is that there's often a delay in seeking treatment. I think I have another poll for this one too. But on average, how long do you think it takes for someone to receive treatment for a mental health challenge here in the United States? So from the time point that they start to experience signs and symptoms of a mental health challenge to the time points where they receive help for that, on average, how long do you think that is? So our options, we got 2 to 4 months, we got 2 years, we got 5 to 7 years, and then we got 10 years. Let's see the votes coming in. So again, thank you for those of you who are able to participate. If you're not sure, that's okay. Take your best guess. I'll give you the answer in just a moment. It's what we're here, right? To learn. Okay, it looks like a majority of people have had a chance to participate. So let's go ahead and take a look at what you all voted for. So got another bit of a mix here, kind of across the board. So we got 17% voted for 2 to 4 months is the average, 39%, which seems to be the majority, voted 2 years. 26% voted 5 to 7 years, and 17% also voted for that 10-year mark. So the average delay in seeking treatment for the United States is actually 10 years. So congratulations to that 17% of you folks who voted for the 10-year mark. It's actually the average, it's a median. So 50% of people will seek or receive help before that 10-year mark, but 50% of people will seek or receive help after that 10-year mark too. And it was quite shocking for me to hear that statistic the first time I heard it, because 10 years is a really long time, right? And I think it's especially concerning for our youth. If it's on average 10 years before they get help for a mental health challenge, if you think about 11, 12, 13-year-old who starts to experience signs and symptoms of anxiety, let's say, or depression, which are two of the most common mental health challenges with our youth. And on average, it's about 10 years before they get help for that. 10 years is a long time. There's a lot that's happening within that 10 years too. They're still developing physically, mentally, emotionally, socially. They're going through a lot of transitions, passing through big milestones, right? Big life events, moving from middle school into high school, graduating high school, going into college, or moving into careers, or just adulthood in general. So I really do think the more open and honest conversations we can have about mental health, and the more information and skills that we can teach our youth on how to manage what they may be experiencing, or know that there are resources out there for them to connect to, then we can lower that 10-year average mark. And I think we are seeing an encouraging trend with our youth, is that they are more open and willing to talk about mental health, especially when they're not doing okay, or when they may be struggling. They're more open to seeking help and seeking out support, and wanting to support the people that they care about as well. So hopefully us as supportive adults can help our youth continue onwards with that trend. We are keeping our eye on suicidality here in Hawaii as well. So this comes from the Youth Risk Behavior Survey. Like I said, they just released the 2021 data. So about 27% of middle school students, a little over 16% of high school students self-reported having thoughts of suicide within the past year that the survey was taken. About 20% of middle school students, about 13% of high school students reported making a plan. About 10% of middle school students and about 7% of high school students reported making an attempt within the past year of when that survey was taken. Now, this survey is something that goes out to schools every couple of years on the odd year numbers. So it's self-reported data. Like I said, we have seen a slight change in these. They've remained kind of about the same. So we haven't seen a true impact on rates of suicidality quite yet, but we again are keeping our eye on the data and research that is continuously being conducted and made available. But the hopeful aspect that I want you to take away from this is that we see these numbers decreasing as we move along this spectrum of suicidality, right? So not everyone who thinks about suicide, not everyone who makes a plan, not even everyone who makes an attempt actually dies by suicide. So what that tells us is that there are a lot of opportunities for us to step in and help, right? For that intervention to happen. And there are a lot of really great suicide prevention efforts that are happening across the state. But with this YRBS survey, the Youth Risk Behavior Survey, it's a really big survey that asks a whole bunch of different questions. These are just some of the ones that are specifically related to suicidality, but I really encourage you all to check it out. The results, you can find them on the Hawaii Health Data Warehouse. And I'll include that link in the follow-up email as well. And you could take a look at some of the other categories that they ask for our youth. Here's just a snapshot comparing 2019 to 2020, I believe, from the online screening tool that Mental Health America as a national organization offers, but you can access these screening tools through our website, which you can see there, mentalhealthhawaii.org, or you can scan that QR code to access these screenings. There's a couple different screenings on there that people can take. These ones are specific to anxiety and depression. But what was interesting, what they found from these surveys is that it wasn't just COVID-19, right? That was a result of this increase. There was a lot of other factors that were at play as well, right? It was broader societal issues, right? So current events, political climate of our country today, things that we are seeing on the news, right? Major governmental decisions that affect our healthcare choices, conflict abroad, all of these things, financial problems, especially during the time when we had to quarantine. A lot of people lost their jobs, so resulted in financial issues. and increases in experiences of loneliness and isolation. So that's what I want you to take away from these online screening tools, is that there's multiple factors that are at play here, but you can take these screening tools online for free as many times as you would like. And we are also keeping a number or eye on the results specific to Hawaii as well. We know that there are some barriers that make it hard for people to access services, even though they may be struggling, even though they may be open and willing to access help and access support. Sometimes there are things that are in place that kind of make it hard to do so. So these are just a couple examples. Insurance and finances could be a big barrier for folks. Maybe their insurance coverage has a limited amount of coverage, or maybe they don't cover the specific types of services that that person may need. Some folks may not even have the finances needed to cover copays, right? To be able to go see a mental health professional or a clinician. Maybe they can't afford the medication that they are being prescribed to them. So we know finances, of course, really big barrier across a lot of different types of healthcare categories, but especially for mental health services. We also see an overall undersized mental health workforce here in the state of Hawaii, but especially so for our neighbor islands. I believe that number is about 360 to 1 is a workforce availability for the state of Hawaii. So essentially what that means is if every single person in Hawaii reached out and wanted mental health professional services like counseling or therapy, then one mental health clinician, one therapist, one counselor would be expected to service 360 people, which is a lot, right? So we already have an overworked workforce, but if absolutely everyone in Hawaii reached out and tried to access those services, it would be really overbearing, right? Overwhelming for our mental health professional community, and it would make it hard for people to access those services in a timely manner, right? We are already seeing kind of longer wait times when it comes to accessing services, getting appointments. So, you know, overall undersized mental health workforce. We also see kind of a lack of awareness. So folks who maybe want to seek help don't quite know how to do that or where to start looking for that help, right? What kinds of services are out there? How do I access them? How do I pay for them? So there's a lot of different types of programs and services that are out there. We want to continue raising awareness and sharing resources, especially with our youth, because if they are struggling, we want them to reach out. We want to connect them to the support that they may need. And we can help them on that journey as well, because that journey looks differently for everyone. There's a lot of different ways to get help, a lot of different ways to access help, but we can, as supportive adults, be a part of that process. We know that stigma is also still associated with mental health. It's one of the bigger barriers, in my opinion, that we see. Stigma affects mental health in so many different ways, but I think what it has the especially harmful effect of doing is silencing the discussion about mental health. It makes people hesitant to reach out for help, or maybe they're wary of acknowledging that something may be going on because they're worried about their family or friends looking at them differently, right? Or judging them for that, or saying that they're weak for reaching out and accessing support services. And we want to break through that barrier stigma, because none of those things are true, right? It isn't an inherent moral problem with that person if they do have a mental health challenge or experience a mental health challenge in that sense. And getting help and reaching out is not a sign of weakness. I think the opposite is true. Actually, if someone is able to recognize that they are struggling and maybe this isn't something that I can handle completely on my own, I need some support surrounding this, and they reach out for that help, or they're open to accepting that help from people who care about them, then I think that's a huge sign of strength, right? Because that's not an easy thing to do, for people to acknowledge that something may be going on and that they need that support. So we need to continue sending those messages that getting help is effective, it does work, and it works differently for everyone. So you know, since we're kind of talking about, or I'm talking about stigma here with you folks, I wanted to just ask a question, and feel free to drop your responses in the chat box feature. Again, you can make it available for everyone to see, or if you want to send it directly to me. But what are some of those common words and phrases that you have heard used to describe people who experience mental illness or mental health challenges? Like, how do you hear it described in everyday conversations, just out and about in the community? How do you hear it described in movies and television shows, written about in news articles or social media? All right. See a couple of responses already. Thank you. Right. Couple sandwiches short of a picnic. Nuts. Yep. We've definitely heard those. Right. Yeah. Being labeled as a quote unquote psycho. Yeah. Crazy. Psycho. Schizo. Absolutely. Chronic. Right. You may hear that people who suffer from serious mental illness are dangerous or violent, right? And we know that's not necessarily true. Only about 4% of people who have a serious mental illness go on to commit violent acts. They're actually more likely to be the victims of violence than they are to be the perpetrators. But that's not necessarily what we see reflected, okay? In our news and in our media. And thank you for those of you who were able to drop your responses in the chat there. These are all the types of terminology that we hear used to describe mental health, right? And do you think that everything that we're seeing in the chat so far has a positive connotation or a more negative connotation? Might be a little bit of a rhetorical question there. Okay, thank you. Negative, more negative. Yeah, definitely a more negative connotation, right? And by utilizing terminology like this, we are adding to that stigma, okay, that's associated with mental health. So we need to change our language. It's important that we talk about mental health, but it's almost just as important to be aware of how we talk about it too. And just a couple slides, I'll be touching a little bit more on this and how we can talk about it in a better way. And I do see a question in the Q&A is how can we encourage people with mental illness to seek out help if they don't want it? And that's a really great question. I'm going to pause on that really quickly. And when we get to the ways that we can help, I'll expand on that one a little bit more. But again, if you have questions, feel free to drop them into the chat or use the Q&A feature. We know that there are more vulnerable populations that could be at a higher risk for experiencing mental health challenges or mental illness. We see more marginalized groups like sexual and gender minority populations. Age could be a factor, right? Our youth are at a higher risk, our kupuna at a higher risk as well. Low income or houseless folks, and geographic location, right? More rural areas can make it hard for people to access mental health services. So we see kind of higher rates or higher prevalence within these more quote unquote vulnerable populations, but it's not that person's identity that necessarily puts them at risk, right? It's just that there are some things and systems in place within our society that make it hard for people from these populations to access help, right? So it's not the identity itself, right? It's not the person themselves. It's just the kind of systems that we have in place in general. So it's really important for us as public health workers, as people who want to raise awareness about mental health, as supportive adults for our youth, that we are checking in and keeping our eye on those youth who come from these vulnerable populations as well. But I will say that there are protective factors that we also want to highlight, right, and bolster and make stronger. Protective factors are those things in our youth's life that help to increase their sense of resiliency. And I know that word resiliency has been one we've heard quite a bit over the past few years, right? We're always talking about resiliency, how we need to be resilient, our youth need to be resilient. But there are actually things that can help promote that resiliency on multiple levels. So we can encourage our youth to prioritize their own mental health, right? To practice self-care on a regular basis, to identify coping skills that are going to work for them in different situations. We can encourage them to rely on faith or spirituality, right? Kind of doing things to take care of their spirit or take care of their soul or connect with something that may be bigger than them. having hope and goals for the future, finding things to look forward to get a little excited about, or to work towards and feel accomplished in. Sometimes it's going back to the basics, right? Making sure our youth are staying hydrated, that they're eating a healthy, balanced diet to the best of their ability, that they are physically active on a regular basis, and that they're getting enough sleep every single night. We know that sleep is so important, not just for our physical health, but for our mental health too. And it's extremely important for the development process for our youth. So we need to make sure they are getting an appropriate amount of sleep every night, and help them realize they have a lot of different types of access to supports, right? Their connections with the people around them, whether it's peers, classmates, friends, family members, grandparents, parents, guardians, aunties, uncles, cousins. Maybe it's other supportive adults they have in their life, like teachers or counselors or coaches, right? Or friends of the family. We need to encourage our youth to reach out to these supportive adults when they are struggling, so that we can help them, right? Help connect them to that support. And what has been interesting with research that's been coming out is that by changing just one of these protective factors, or by making one of these things stronger, is about 3 times more impactful than trying to change one risk factor, which I think is important for us to know. It doesn't mean that we should disregard risk factors, or we shouldn't be aware of what those are, because we absolutely should. But we should also be focusing our time and energy on these things too. And a lot of these things we do have the ability to influence. So we do have the ability to make stronger. Whereas where it comes to risk factors, it may not always things that we necessarily have control over, especially when it comes to trauma, right? Or traumatic events. It's not like we could just go back in time and stop that thing from ever happening, or change the outcome of something. But a lot of these protective factors we do have the ability to influence. So we also need to be making these things stronger. All right, so what? It's like one of my favorite slides for this presentation is that so what question. It's one of the biggest questions we often ask ourselves in public health, which is in my background, is that so what, or that now what question. Now that we've done all this research, right, we've looked at the statistics, we've identified risk factors, we've identified protective factors. We've established that there's a need in our communities, that there's vulnerable populations that could benefit from extra support. What are we going to do about it? Or what can we do about it? How can we help? So I'll start off by just kind of showing a framework or a model. It's called the social ecological model. So if you're a public health person too, then you know we love our models and we love our theories, right? To be able to help us kind of get a better understanding, or be able to explain different types of human behavior, or how we can help in different ways. So just like I said in the beginning, that the goal for this presentation is not to turn you into a clinician, right? Or a therapist or a counselor. I'm also not trying to turn you into a public health professional either. Really what this model says is the importance of prevention efforts, okay? And here at Mental Health America, we really highlight the importance of prevention and early intervention. So in summary, this is a model or a theory that states for any prevention effort to be effective, for it to be sustainable, it needs to happen on multiple levels, right? So on an individual or interpersonal level, right? What are specific types of services or treatments can people reach out and connect to? How are people connecting to each other, right? Within their social networks of peer support programs, encouraging family engagement. On an organizational level, right? What kind of training mandates are in place, or what's that organizational structure and culture look like that promotes mental wellness or highlights suicide prevention efforts? On a community level, right? How are these schools and organizations working with each other to promote mental wellness within a community? And then a public policy level, right? What kind of policies are in place, or maybe not in place? Where are those gaps that make it hard for people to access the services that are available and really support mental wellness on a public policy level? So like I said, that's just a quick summary. For any prevention effort to work and to be effective, there's got to be multiple things that are happening at the same time. So one of the ways that we can help is to talk about it. We want to talk about mental health It's important that we do, but we also have to be mindful about how we are talking about mental health as well. It's important, especially for our youth, that we are able to create those kind of safe spaces to have those open and honest conversations. We want to talk with them about what's going on. We want to be able to answer any questions that they may have, dispel any myths that may be associated with mental health. For example, like someone who enters into professional type of treatment or connects to a mental health professional, it means that they're going to need that treatment or need to connect to that professional forever. That's not necessarily true. A lot of times people are able to learn the skills that they need to be able to cope, right, and get through their day-to-day. But connecting with that professional type of treatment just helps that process, right, and that journey to recovery. So we can dispel myths like that. We can provide information about a general kind of signs and symptoms of various mental health challenges, so our youth know kind of what to look out or what to listen for, or other adults, right, who have youth in their life. Well, how do we notice, right? How do we practice our listening skills so we can identify when a youth possibly may be struggling? We want to normalize talking about mental health. You know, it's okay to not be okay, right? It's not a problem to have a problem, but it is a problem if someone feels like they can't talk about it or that they can't reach out for help and get support surrounding that. So we want to continue to offer messages of hope that getting help is effective. It does work, okay? But it looks differently for everyone. So we can help be that bridge, right? Or be that connection for youth who may be struggling to the types of support that they need. We can also support each other, right? We want to check in with those in our social circles, okay? With our family, with our friends, but we want to check in with ourselves too, right? Sometimes we may not be the best person to help or to offer that support, and that's okay, right? But it's really important to kind of check in with yourself and see, am I the right person? Do I have the mental or emotional capacity to be there for someone right now? If I don't, then maybe there's someone else who's a better fit, right, to be able to offer that support to that youth, and we can help make that connection. And when we say checking in, you know, it doesn't have to be anything super grand or huge. It could be something as simple as a text message or a message on social media, okay? Just asking how that person's doing or checking in and seeing if they need to talk about anything. So when we say checking in, it is important, but it doesn't have to be super extensive. We can start small, right? Just kind of building that conversation and letting the youth or that person know that we care about them, right? And we are here, we want to help them. We want to do our best to do some active listening without any kind of judgment or biases coming from us. Now, listening may sound like a really easy thing to do, but it actually takes some work. Okay, it's more than just sitting there and letting someone talk at you. I have so much patience, I could probably sit there and let someone talk at me for hours, but that's not really listening, right? Sometimes it's listening to the things that people are saying, or maybe what they're not saying. We have to read in between the lines a little bit. Sometimes it's asking questions for clarification, right? Did I understand you correctly when you said this? Or can you explain a little bit more about what you meant when you said this? We want to listen with our entire bodies too, not just with our ears to the things that people are saying or what they're not saying, but listen with our eyes. And that probably doesn't make a whole lot of sense, but really what we mean by that is being observant, right? Is someone acting differently than they normally do? Are there kind of changes in patterns or behaviors, changes in people's mood that we are noticing, right? That it's been some time, it's been a couple weeks, and we're really starting to notice a great opportunity to check in with them. And we also want to listen with our hearts and with our stomachs too. And I know it's not a very scientific thing for me to say, but if something that someone says or something that someone does just doesn't quite sit right with them, it gives you that bad feeling in your stomach, don't just ignore that feeling. Hey, that instinct could be there for a reason. So we want to ask more questions, including those tougher questions, especially if we are concerned that a youth may be having thoughts of suicide. We also need to ask about those, right? Are you thinking about suicide? Are you or could you be thinking about killing yourself? It's a common thing we may have heard that we don't want to ask those direct questions. We don't want to talk about suicide because we don't want to put the idea in someone's head. And it does not work like that. There's so much research out there that shows that by asking those direct questions, you are not planting the thought in anyone's head, right? If we don't ask, then we don't know. And if we don't know, how are we supposed to try to help that person? And we want to encourage help-seeking behaviors, right? I've already said it quite a few times. We want to send that message. Getting help is effective. It does work, but I think it's a good time to address that first question that we had in the Q&A is how can we encourage people with mental illness to seek help that don't want it? That's a very real situation, I think, that we may encounter. Not everyone is in a place where they are ready to acknowledge that something may be going on. Maybe they're not ready or in a place to reach out for help or to be open to seeking or receiving help. And it's kind of tricky situation to navigate with our youth. I think we have a little bit more options available to us, especially if that person is in a crisis, right? Or that youth is in a crisis. Safety is our number 1 priority. So we need to address any kind of safety concerns that we may have. We can encourage conversations with that youth's family, just say things that maybe we have been noticing or things have been going on, and maybe we can leave some information with that family or with that youth, so they have a starting place when they want to find out more information or identify kinds of resources that are out there. We're kind of building that trust, like building that bridge. We're keeping our door open. Sometimes we do have to meet that person where they're at and kind of be respectful of the space that they are in, unless of course that person is in a crisis. Then we need to make sure that they are connected to support as quickly as they can be. But if they're not in a crisis, they're just kind of in general struggling, we are checking in, right? We are keeping our eye on that person, and we're letting them know that I am someone that you can come to down the road if and when you feel ready, okay, to talk about this. So I hope that was an okay answer to that first question that you had in the Q&A. And I also see one says, has a possible correlation between social media use and youth suicide rates been studied? Yeah, it's definitely been something that's been looked at and definitely talked about a lot. Is the impact that social media has on our youth's mental health. We hear a lot of mixed messages, yeah, that there could be some good things about social media, but there's definitely some bad parts of social media too. And I think it really comes down to how it's being used by our youth. We want to encourage healthy social media habits, and there are ways to do that. There are some resources that are starting to come out that can help our youth utilize social media in a safe, responsible, and healthy way. But that's kind of hard to do, right? With these platforms and these algorithms that kind of learn from what people like and post and share, it could get into a rut of seeing a lot of negative content. And it's easy for our youth to access huge amounts of information, right? Very quickly and very easily. So very accessible, especially all the negative things too. So we need to encourage our youth to, follow the pages, right, or profiles that also share positive stories, right, or things that they like, and encourage healthier interactions with each other. We want to encourage our youth to be responsible, even when they're interacting online or utilizing social media, to think about what they post before they post it, to think about their comments before they comment. And also know that it's okay to take a break from social media every once in a while, right? Taking a step back. And I know that's probably really hard to tell a youth, right? To take a break and to unplug every once in a while. But we can encourage our youth to check in with themselves too, right? Ask that question, do I feel better after going on TikTok or Instagram or Discord or any other kind of social media platform that may be out there? If that answer is no, or I'm not sure, or I actually feel worse whenever I go on social media, might be a good indication that's having more of a negative impact on their mental health. So maybe we can explore other ways that they can, get support or connect with other people and just kind of take that step back from social media. So a really long-winded answer to your question. And those are only a couple of ideas of ways to practice healthy habits on social media use, especially with our youth, but there are some resources that are out there as well. We also have lots of campaigns that are out there that help to increase awareness, right? Since we want to continue this conversation about mental health, there's some really great campaigns and videos and public service announcements that are out there that help to inform people about what to look out for, what to listen for, how to start that conversation. It could be incredibly awkward to start that conversation about mental health, to talk about emotions and feelings, to help our youth identify specific emotions and how they can cope with them, right? Or find ways to support themselves surrounding them. So one example is Seize the Awkward. It's a really awesome campaign. They've got a bunch of videos out there, but the one I want to highlight is one that was launched by us, Mental Health America of Hawaii. It's called No Shame, Get Help. So I'll go ahead and play this video and you can take a look at our campaign.
I noticed something's up with you.
How have you been?
I feel like you just haven't been yourself.
I thought we could talk about it.
Learn more at noshamegethelp.org.
Okay, so just a quick little video, right, a public service announcement. But No Shame Get Help is a really awesome website. It's easy to navigate to. It's easy to navigate in general. So noshamegethelp.org, it gives you more information about what to look out for, what kind of signs and symptoms when someone may be struggling with their mental health, and also what kind of resources are out there, especially if someone may be approaching a crisis or in a crisis. There's really quick, easy links that they can click on to give them direct access to the National Suicide and Prevention Lifeline, to the Hawaii Cares line, so crisis resources on this website as well. I encourage all of you to check it out when you have the time. I'll include the link in the follow-up email, but I also encourage all of you to share this resource with any kind of youth that you may have in your life, right? We want to let our youth know that these types of websites are out there where they can find out more information and connect to those resources. We also want to be involved, right? We want to educate ourselves, which is exactly what every single one of you are doing simply by logging on with me today and being present for this webinar and asking questions as well, to educate ourselves, what to look out for, how to connect, what kind of resources are out there. We want to be involved by continuing to spread awareness, right? Sharing resources, sharing information. But I will say that if we are sharing resources and information, especially on social media, where it can reach a really broad audience very quickly, that we want to make sure we're doing our homework, that we are making sure that resource or that piece of information is coming from a reputable source, from a reliable organization. If it's not, maybe best to kind of not pass that along until we can do some fact checking, and be involved in community events as well. There's some really awesome ones that are out there that happen every single year. We have our Mahalo Awards Luncheon coming up for Mental Health America of Hawaii at the beginning of May. I believe registration is open, so you can buy your tickets, where we can honor people from the community who are doing some really awesome work to raise awareness about mental health. And thank you, Brian, our executive director, is dropping these links in the chat for you folks too. We have the annual suicide prevention mini conference on Maui every single year. There's Out of the Darkness Walk for American Foundation for Suicide Prevention, and their Hawaii chapter, International Survivors of Suicide Loss Day. So there are a lot of really awesome events. May is Mental Health Month, so events that will be happening at the Capitol as well. So reach out if you want to become a little bit more involved or attend any of these events. We can help point you in the right direction or connect you with those organizations that are hosting these really wonderful community events. I think especially when it comes to suicide prevention, it's something that we all have to work together towards, and connecting in that way as a community is really encouraging, right? And it can be quite healing as well. And another way that we can help is to take care of ourselves, right? Make sure that you are taking care of yourself. This is hard work, especially if you are supporting someone who may be struggling with their mental health, or if you interact with youth in your life frequently, whether it's in a professional capacity or a personal capacity. So thank you for doing the work that you do. And remember, practicing self-care is not selfish by any means. We want to make sure that we are in the best place that we are at our best capacity to be able to show up and help other people. But we can't do that if we're not taking the time to take care of ourselves too. Even if all you can manage is 5 minutes a day, a couple times a day to practice that self-care or find that time to practice self-care, do that on a regular basis, because that's you taking care of yourself, right? And over time, you will notice a difference. And really the cool thing about practicing self-care is that you get to decide what works for you. So I encourage you all to brainstorm what practicing self-care looks like for you. And if it helps to break it up into different categories, you can absolutely do that. Think about those people, right? Who are those people that you know you can go to when you need someone to talk to, when you need help, when you need support, someone you need to vent to? But who are those people that you just like interacting with in general because they make you laugh, right? They make you smile. They find the funniest TikTok videos and send them over to you, right? The funniest memes, whoever that may be. Identify who those people are too, because we got different types of connections with different people in our lives that we can rely on at different times. Think about those places that you go to practice self-care, whether it's a place that you go to feel safe or to relax and unwind, or a place that you go to because you like going, right? And try to be specific. Don't just say, I like going to the beach, right? Where's your favorite beach to go to? Where's your favorite spot to hop into the water, or your favorite place to catch a sunset? And then think of those activities as well, specifically those activities that help kind of refill your cup or recharge your batteries, right? Whether it's to help you de-stress, relax, unwind. Maybe it's something that brings you joy and happiness and satisfaction. Maybe it's something that makes you feel productive, right? It kind of sparks that sense of flow within yourself. Whatever that may be, identify all of those activities as well, but really sit down and take the time to brainstorm what your self-care action plan looks like. That way, if you ever do need to connect to that plan, right, or practice self-care, you'll already have thought of all of these wonderful people, places, and activities to connect to. There's some really great resources that are out there as well. National Suicide and Crisis Line 988. It was just launched. It was formerly the National Suicide Prevention Lifeline. They just made it a whole lot easier for us to remember. Instead of that really long 1-800-273-TALK number, they shortened it down to 988. Okay, so you can call, you can text 988. They also have a chat feature, right, on their website that people can connect to these volunteer counselors if they may be experiencing a crisis. The Hawaii Cares line is kind of our local crisis line, but they've also expanded their services as well. So anyone who is looking for mental health services or substance use services can also call the Hawaii Cares line to access those, but they do offer 24/7 crisis lines. So if you're calling 988 from an 808 area code, you'll be connected to the Hawaii Cares line just based off of the area code. So it really depends on the area code of the phone number you're calling from. For example, if I called from my cell phone, my area code is 714, so I would probably be connected to someone in Southern California. But no matter what area code of the phone number you are calling from, these operators and these volunteers are trained to help identify resources that you need in your area. They just may have to ask a little bit more questions. We also have the crisis text line, right? For those youth maybe who don't like talking on the phone or making phone calls, they can access support services via text. The Trevor Project, Trevor Helpline, is one of my favorite resources to share, is for our LGBTQ+ youth, right? And so one of those kind of more vulnerable populations or marginalized communities. They have their own 24/7 hotline, they have their own chat feature, they have their own text feature as well. There are resources specifically related to us as well. So we have a whole suite, and I realize I put the 2022 mental health trainings brochure on there. My apologies. We should have the 2023, which I will make sure to share in that follow-up email. But we have a whole suite of self-care wellness trainings. We offer mental health first aid, both the youth and the adult version. We have youth trainings too, our youth suicide and bullying prevention and self-care for youth trainings for middle school and high school age youth. So if you're working at a school or with an youth serving organization, reach out to me. We'd be happy to bring these youth trainings specifically to your youth. We also have Become a Defender, which is a bullying prevention training designed for upper elementary school age kids. We have a Finding Help resource directory. So, we have been compiling different types of programs, resources, and services, identifying them, I should say, in the state of Hawaii that are related to mental health. So it's a really good starting point for identifying programs and services that may be out there. But feel free to give us a call. We can help answer those questions and point you in the right direction as well. And that Finding Help resource directory can be found and downloaded for free at our website, and all of our community trainings as well. We offer at no cost to the community. We are all over social media. So if you are all over social media as well, feel free to follow us. We got a couple groups running on Facebook. We got a couple Instagram pages. At Libna Owl is kind of our self-care page. We also have our general MHA Hawaii page. Our YouTube channel is where we house a lot of our recordings for our presentations. So this one is going to be going up there once it finishes processing. But we've got really fun short meditation videos on there. There's really cool YouTube shorts to help raise awareness about mental health, different ways to practice self-care. And we are on TikTok as well. And there's another QR code for those online mental health screenings that I was talking about earlier. And thank you for dropping that link in the chat as well, Danielle. We can access free online screening services as a tool for us, not necessarily to diagnose ourselves or to diagnose another person, but as a good starting point to find out more information about what may be going on. And like I said, you could take it for free as many times as you want, and it does give you recommendations at the end based on your results. But here's our general kind of contact information. I know I did say I would leave some time at the end for questions if people do have, but check out our website. We've got our Oahu office address on there, but we have both our Oahu and Maui office phone numbers as well. Feel free to reach out if you do have any questions. Drop it in the chat, use your QA feature, or if those questions pop up later, today, next week, next month, whatever that may be, please feel free to reach out. We are always happy to do our best to answer those questions or connect you with resources if you may have. All right, so I do see kind of a comment in the Q&A is, I know someone who called and texted suicide hotline, but he said that it was very scripted and that quote unquote they do not help unless you are actively suicidal at the time of the call or text. Please comment to this. What is the best resource for those who are struggling but actively suicidal? We have heard experiences of this, you know, since it is kind of a national resource, especially for 988. But Hawaii Cares, of course, is a local version of it. Is that there have been a lot more calls and texts and people looking to access those crisis services. So unfortunately, they do start off with a recording, right? And they have different options. Like there's a specific line for veterans. There's a new line that they're launching for LGBTQ plus youth when they call 988. But sometimes they do get a little overwhelmed with the amount of calls that are coming in. So they will have to call back and try again. And I know that's probably not the answer that we want to hear, especially when someone is actively suicidal or in a crisis. But we want to send that message to keep trying, right? To keep calling, to keep reaching out, but to identify other people that are out there. And I will say, if someone is actively suicidal, you can also call and text 911, right? And contact the emergency services to get them on the scene quickly, right? And connect to that person just to ensure their safety. There are crisis intervention trained officers with the Honolulu Police Department, the Maui Police Department. I believe they've been doing some classes on Big Island as well, but these are officers that have gone through about 40 extra hours of training specifically related to how to connect with someone who's experiencing a mental health related crisis. So when you call 911, you can tell them, I think this may be a mental health crisis or emergency, or this person may be suicidal. So can you please notify whoever is coming onto the scene to keep that in mind, right? When they come out and reach out. So, you know, keep calling, keep trying to reach out, but also identify other kind of supports that may be out there. Any volunteering opportunities for us specifically? We have a couple. We're kind of a smaller organization, but we do a lot of big things. So we have our Like I said, Mahalo Awards Luncheon coming up. There may be some volunteer opportunities available to that, but feel free to reach out, give us a call or send us an email, and I'll drop our general email in the chat as well. Maybe we can help connect you with other organizations who are looking for volunteers for their events. Okay. And I see what is the best resource for those who are struggling but not actively suicidal at the time. I would say reaching out and finding support via counseling, right, or therapy. It could be a great way to kind of get that support if they are struggling with their mental health, is connecting to a professional. We can also encourage people to reach out to their general doctors, practitioners, their PCPs, to address not just the medical side of things, but maybe let them know that they may be struggling with their mental health as well. They could get referrals from their PCPs. Community health centers are also really awesome resources to reach out to and get that behavioral health support. If it's a youth, a student in a public school here in Hawaii, they can go through those channels as well. So connecting to their school counselor, their social and behavioral health specialist that they have in every single district. Through the DOE, they can access those services. So there's a lot of resources that are out there, but also check out the Finding Help resource directory. There's a lot of really great stuff that's in there. And the cool thing about it too is that it is separated by islands. So someone is able to identify a resource in their area or where they live. So I hope that kind of helps answer that follow-up, someone who may not be full-blown crisis or actively suicidal. And let me just really quickly check for any other questions. Thank you, Jerry, for dropping our general email in the chat. I'm not seeing any other ones so far. But again, please reach out if you do have them. Thank you for those of you who stuck it out with me for your lunch hour, who were asking questions. There were absolutely great questions to ask, needed questions to ask and to be addressed. So I thank you for that. I'm just going to really quickly drop a link in the chat if you don't mind. We greatly value your feedback. We want to make sure the information we're providing you is helpful and is relevant and is important to you. Because if it's not, then we want to change that, but we don't know unless we ask you. So please fill out our evaluation survey. It should pop up as well in your browser once I end this webinar, but looks like I'm giving you back about 4 minutes left to your lunch hour. So I hope you use that 4 minutes to do something nice for yourself and practice that self-care. I'll be sending out that follow-up email very shortly with everything that I promised. But thank you so much, everyone, joining us for today. Have a great rest of your Monday, right? Starting off the week. Have a great rest of your week, and we'll see you next time. Thank you.